Hey guys, welcome back to my channel. You know by the title of this video, I will be sharing with you signs and symptoms I experienced with my two ectopic pregnancies, one which happened earlier this year, and the first one I experienced was in 2015, and I just want to share with you my experiences with both of those so that you can kind of keep that in the back of your mind if you are trying to conceive or if you are already pregnant and you're early in your pregnancy. I don't want to scare anybody, but my symptoms definitely do not match the warning signs that you can look up online. So if you don't know what an ectopic pregnancy is, it is when the fertilized egg implants anywhere outside of the uterus. Most of the time it implants in the fallopian tube, and this is called a tubal pregnancy, although it can implant on the ovary and the cervix, and I've even heard of implantation on a kidney. I think it's super rare, but it's possible. If an ectopic pregnancy continues to grow, it is a life-threatening situation and the baby must be removed. So with my first one, my husband and I had been trying to conceive for 16 months. First clue, but it's definitely hindsight, and this is not necessarily going to be true for every ectopic pregnancy, but for me, I had 0 pregnancy symptoms, and I made it to 7.5 weeks before I had any ectopic symptoms. So I went along for 7.5 weeks with no symptoms, no fatigue, no nausea. Now that I've had 3 kids, I know that that is unusual to get to 7.5 weeks and not have any symptoms. So that was my first clue, is I had no pregnancy symptoms. I also did not have any pain leading up to the event, and the event that happened was me passing out. I passed out in the bathroom. I was using the restroom, I stood up and I passed out. That was the very first symptom I had indicating any problem was going on, and again, I was 7.5 weeks when this happened. Lightheadedness and fainting is definitely a big warning sign when it comes to ectopic pregnancies. I did not have any pain leading up to this, but that is one of the emergency signs. So if that happens to you, get to the ER immediately if you are pregnant and you pass out. After that, we called the ambulance. They checked all my vitals, which everything looked fine. And I opted not to go to the ER because I was like, well, all my vitals are fine. I'm sure this is just normal. It's not normal at all. After a few minutes, my husband insisted that I go to the ER. He drove me, and there I continued to pass out, even just sitting down. I was just passing out in the wheelchair. So once they saw that happening, they immediately got me back. I started to get really cold, and this is due to a lot of blood loss because my fallopian tube ruptured in my abdomen. So I was bleeding inside of my body, and that's what was causing me to faint. The thing that never happened ever during that was I never had any vaginal bleeding, and that is one of the signs that they tell you is a reason to be concerned about ectopic. So just because you're not having any vaginal bleeding does not mean something is not wrong. Again, I don't want to scare anybody, but that was one of the questions the second time around that the nurse would ask me on the phone, is if I was having any vaginal bleeding. And even with the second time, I never had any vaginal bleeding. So even though that may be a sign, it never happened to me. Again, that's why I'm putting this out there, because I don't want someone who might have a concern and might be having some symptoms, but not all the symptoms, brush it off and not get looked at. Once we did start going to the hospital, I did have abdominal pain that was usually triggered by, like, if we hit a bump on the road, it hurt really bad. So this happened after I fainted. I remember so vividly, they were doing a vaginal ultrasound, and my husband, being the jokester he is, said something and I laughed, and that was extremely painful. So I did eventually have abdominal pain, but it was after I fainted. Later we discovered that I lost 1,600 milliliters of blood into my abdomen. They tried to repair the tube. It was my right tube. And obviously we lost the baby. That was my first ectopic pregnancy. It was much more dramatic and life-threatening than my second one, but my second one still had different symptoms. It was completely different. So fast forward 6 years and 3 successful pregnancies and babies later, we were trying for our 4th baby and I get pregnant. I got to about 5 weeks pregnant. The best way I can describe it is that I just felt like I had gas all the time and it wasn't gonna happen. And I just felt like I had to use the bathroom and nothing was happening. My kids would sit on my belly and it would hurt. So just very, very different than my other one. So again, I just kind of brushed it off. I called my doctor's office, talked to a nurse about it. Again, she would ask if I was having vaginal bleeding and my answer was no. So she, you know, that was like, it seemed to be the thing that if I said yes, oh yeah, well you need to come in. And that never happened. So I did go in for a blood draw. This would be my second blood draw to see if my levels were going up appropriately. And straight up, I just got there to the office and I said, I would like to see a doctor. I'm concerned this isn't normal for me compared to my other pregnancy. So they got me in and I was explaining, I just feel like I'm really gassy, I'm crampy, I feel like I have to go to the bathroom and nothing's happening. And again, the nurse just seemed very unconcerned. And because I wasn't bleeding or anything else, she conveyed all this to the doctor. They got me in for an ultrasound and they found the baby not in my uterus, but in my right tube again. Come to find out later after surgery, it was actually implanted on my ovary. Back to my symptoms. I became very concerned the night before my appointment for the blood draw because I could hardly sleep. I couldn't get comfortable. I just felt like I had so much gas. That's the only way I can explain it. I even got Gas X because I was convinced I was just gassy, like a gassy pregnant woman. And when my husband got home, I told him, I was like, I need help getting this gas out. I laid on my back. He was like doing the baby bicycle thing, like pushing my legs up, trying to get it to come, like, cause it was just that painful. And at that point when it hurt when he did that and I could feel like pain up in my back, that's when I got worried. So one of the other signs is shoulder pain, because if you have bleeding going on inside, it can make other parts of your body hurt because it's fluid where fluid shouldn't be, I guess. So that was another big indicator to me that something was not right. And I'm trying to think if there was anything else. I think that was the biggest thing, was the gas and then my back pain. And just like knowing that every single time my kids like sat on my belly, I mean, to like sit on my lap, you know, kids crawl on you when you're a mom. And the fact that that hurt and that was unusual for me, even though I kept trying to just like dismiss it, like, oh, it's probably fine, but I'm gonna talk about it. Even the nurse dismissed it. So I just want to put this out there. I don't want to say she dismissed it, but it was like, oh, you're probably fine. So I guess it was being dismissive, but I'm not saying that she wasn't in the right mind to kind of think that everything was fine, because even I was like, yeah, it's probably fine. So I just wanted to be out there that your symptoms for this issue may not be textbook. And if you think that there is something to be concerned about, insist to your doctor to be looked at. Most of the time they don't want to do an ultrasound till like 8 or 12 weeks, right? And I don't understand that when there's a possibility that this baby could not be in the right place. And by the time you're having symptoms that tell you that you possibly are having an ectopic pregnancy, it's too late to do anything but surgery, and there are other options, but essentially it's like an IV thing or a shot or something like that, where it essentially dissolves the baby, but they can't use it if it's at a certain size, like it's not going to work. They have to surgically remove it. In my first one, I was 7.5 weeks. In my second one, I was 5.5 weeks. It was still too big to use that medicine. But if we're not even checking to see if the baby's in the right place early for every single pregnancy, I don't understand why most offices do not confirm pregnancy with an ultrasound as soon as possible so that it can be prevented. And if you know the answer, please let me know or point me in the direction of someone who can answer this question, because it seems like you're just putting a bunch of women's lives at risk and their health and, you know, essentially their fertility too, by not checking. So that's what I think. Let me know what you think. Let me know what your symptoms were. If you have any questions for me, just be safe. Don't overly worry and analyze everything you're feeling if you're pregnant. I just wanted to put my experience out there because it did not follow what healthcare people expect. That is all for this video. Thank you so much for watching. If you liked it, give it a thumbs up. And if you want to see more videos of mine, I do vlogs and other just sit down talking videos like this. So subscribe if you haven't, and I'll see you in the next one. Bye.